Committee on Health, Education, Labor, and Pensions will please come to order. First, some administrative matters based on the advice of the attending physician and the Sergeant at Arms after consulting with the Department of Health and Human Services and the Centers for Disease Control. Individuals in the hearing room are seated 6 feet apart. As a result, there's no room for the public to attend in person. Representatives of the press are working as a pool. The hearing may be watched online. An unedited recording will be available on our website, www.help.senate.gov. All of our witnesses today are participating in person. We thank you for that. Some senators are participating by video conference. Before I make my opening statement, I'd like to say a word about masks. The Office of Attending Physician has advised us that we may remove our masks and talk into the microphone as long as we're 6 feet apart. So that's why my mask is off right now, because I'm 6 feet away from everybody else. But like many other senators, when I'm walking the hallways or on the Senate floor, I'm wearing a mask. People wear masks because CDC has said, quote, simple cloth coverings slow the spread of the virus and help people who may have the virus and do not know it from transmitting it to others. Unfortunately, this simple life-saving practice has become part of the political debate that says this: if you're for Trump, you don't wear a mask, and if you're against Trump, you do. That's why I've suggested that the president occasionally wear a mask, even though in most cases it's not necessary for him to do so. The president has plenty of admirers. They would follow his lead. It would help end this political debate. The stakes are too high for this political debate about pro-Trump, anti-Trump masks to continue. Around here, senators and staff wear masks because we don't want to make each other sick. For example, I was exposed to COVID-19 by a pre-symptomatic staff member on my way to Dulles Airport, and as a result had to self-quarantine for 2 weeks. The Senate physician told me that one reason I didn't become infected was because the staff member was wearing a mask, and that, in the physician's word, greatly reduced the chances of an exposure. It's also a pretty good way to make a statement. I like to wear my plaid mask. Dr. Fauci uses his mask to demonstrate his loyalty to the Washington Nationals. Senator Kaine is either a cowboy or a bandit. I'm never sure which. If you want college football to return this fall, here is what Coach Philip Fulmer, our athletic director at the University of Tennessee, says. If you really want to see some football this fall, wear a mask. That might have more influence than anybody else in Tennessee. The United States is in the midst of a very concerning rise in COVID-19 cases and hospitalizations in many states. The experts in front of us have told us that washing our hands, staying apart, and wearing a mask are 3 of the most important ways to contain the disease and slow the spread of the virus. I'm grateful to the Rules Committee, the Sergeant at Arms, the Press Gallery, the Architect of the Capitol Police, our committee staff, both Democratic and Republican, Chung Shek and Evan Griffiths, and all for their hard work to keep us safe. Now, Senator Murray and I will each have an opening statement, and then we will turn to our witnesses, who we thank for being with us today. Each will have 5 minutes. We'd ask you to summarize your testimony in 5 minutes, and then the senators will have a chance to ask 5-minute round of questions. We have full participation today, it looks like. It should be an interesting morning. Among the casualties of this dangerous and very sneaky COVID-19 virus are the 75 million students who were sent home from school and college in March. Add to the casualties the teachers who weren't prepared to teach remotely, and the working parents who suddenly had children at home and who weren't prepared to homeschool. Add the lost sports seasons and the once-in-a-lifetime graduation opportunities. Then there were unprecedented dilemmas for administrators in inadequate school budgets. Being sent home from school doesn't rank with the sickness and the death that the virus has caused. The United States has over 2.5 million cases of the virus and over 125,000 deaths, according to Johns Hopkins. While states and communities continue to take action to keep people safe, nothing, though, was more disruptive to American life, and nothing would head it back toward normalcy more rapidly than for those 135,000 public and private schools and 6,000 colleges to reopen this fall. Earlier this month, this committee heard from college presidents and school leaders about their plans for safely reopening this fall. This hearing is an opportunity for an update and to hear from the nation's top health experts on how headmasters, principals, superintendents, chancellors, and college presidents can open their schools safely just a few weeks from now. This committee last heard from today's 4 witnesses on May the 12th, when 3 of the 4 were quarantined and most of the senators were participating virtually. That was one of the first virtual Senate hearings in history, and surely the best watched. Every network carried the 2.5 hours of statements and questions and answers from senators. The question before the country today is not whether to go back to school or college, or child care, or work, but how to do it safely. Even though COVID-19 has not, in general, hurt young children and college-age students nearly as much as older and more vulnerable Americans, there is some health risk. But in my view, the greater risk is not going back to school. Guidance for reopening schools from the American Academy of Pediatricians tells school administrators the following. Our academy strongly believes that all policy considerations for the coming school year should start with the goal of having students physically present in school. The academy continues, the importance of in-person learning is well documented. And there is already evidence of negative impacts on children because of school closures in the spring of 2020. Lengthy time away from school and associated interruption of supportive services often results in social isolation, making it difficult for schools to identify and address important learning deficits, as well as child and adolescent physical or sexual abuse, substance use, depression, and suicidal ideation. This, in turn, places children and adolescents at considerable risk of morbidity and, in some cases, mortality. Beyond the educational impact and social impact of school closures, there's been substantial impact on food security and physical activity for children and families. That's the American Academy of Pediatricians. Dr. Lloyd Fisher, the incoming president of the Massachusetts chapter of that Academy of Pediatricians, told reporters, while for most children, COVID-19 has not had the devastating and life-threatening physical health effects that have occurred in adults, the negative impact on their education, mental health, and social development has been substantial, unquote. Nothing can take the place of the daily face-to-face interaction our children experience when attending school in person, Dr. Fisher said. Many American colleges, overall considered the best in the world, will be permanently damaged or even closed if they remain, in Brown University President Christina Paxson's words, ghost towns. Mitch Daniels, the president of Purdue, wrote in a Washington Post op-ed, quote, failure to take on the job of reopening would not only be anti-scientific, but also an unacceptable breach of duty. So today, in addition to hearing more about the concerning rise in cases and hospitalizations in some states, I'd like to ask our witnesses in their statements and answers to questions to put yourselves in the place of one of America's approximately 14,000 superintendents of school districts, or the principal or headmaster of one of 135,000 schools, or as president or chancellor of one of 6,000 colleges, and help them answer the question of how to reopen schools and colleges safely. So, Dr. Fauci, I hope that in your opening statement or answers to questions, you'll suggest steps a superintendent might take to open schools safely, and not only how to keep children safe, but to keep safe the adults, teachers, parents, grandparents with whom they come in contact. Dr. Hahn, will there be treatments or medicines this fall that will help speed the recovery from COVID-19 or reduce the possibility of death? I believe the fear of going back to school or going anywhere these days is in large part because of the fear of severe illness or even death. If that risk can be lessened by new treatments, it should increase confidence in going back to school. I'd also like to commend Dr. Hahn and the work the FDA did to get tests on the market quickly as possible to help understand the spread of the virus. Since then, FDA has worked out which tests have not worked as well as they should and taken steps to remove them from the market. That's what's supposed to happen in the urgency of a pandemic. Admiral Giroir, at our last hearing, you said you expected there to be 40 to 50 million diagnostic tests available each month by September. Is that still true? And exactly, how does the school district go about making sure it gets those tests? And who pays for them? What are the prospects from the Shark Tank at the National Institutes of Health that there will be new, reliable, and inexpensive tests so we can have even more widespread testing? And Dr. Redfield, you're continuing to work on updated guidelines about going back to school and college safely. And are CDC employees going to be available in our states to help work with school districts to develop their plans? And what advice do you have about the arrival of the flu season this fall at the same time as COVID-19? This is a lot to discuss, but there will be time during the next 2.5 hours to answer most of those questions. Let me quickly highlight 3 areas that have come up in our 4 earlier hearings this month that I think need clarification. First, on contact tracing. No doubt contact tracing is crucially important. It identifies the people who might have been exposed so that they don't in turn expose someone else. According to an NPR report on June 18, states have already hired at least 37,000 contact tracers. State officials and Johns Hopkins Center for Health Security issued a report estimating the need for as many as 100,000 contact tracers. Several reports suggested Congress appropriate money to pay for those tracers. The reality is Congress already has. On April 24th, Congress appropriated $11 billion, which has been sent to states and tribes for the expenses of testing. That legislation explicitly said the money could be used for contact tracing. This is in addition to $755 million from the first emergency appropriations legislation on March 6 that could be used for contact tracing. And that's in addition to the March 27 legislation in which Congress appropriated $150 billion, $1.5 billion in the CARES Act for states, territories, and tribes to use for COVID preparedness and response. The CARES Act also included the $150 billion to states, but a significant amount of that $150 billion has not been spent, even though it is all designated for expenses related to COVID-19, which include contact tracing. For example, Tennessee's governor has told me he's reserving as much as $1 billion of that so that he can determine what flexibility he has in spending the money. Washington State has not spent as much as $1.2 billion. Missouri State Treasurer says they've not spent about $1 billion. According to the report by state health officials in Johns Hopkins, an average salary for a contact tracer would be a little more than $35,000. This adds up to about $3.5 billion for 100,000 contact tracers. So the point is, Congress has already sent to states plenty of money to hire all the contact tracers that are needed. Second, who pays for the testing? In the CARES Act, Congress voted to make all COVID-19 tests available to patients at no cost. This meant insurers would cover diagnostic tests, which detect whether a person is currently infected with the virus, and also antibody tests, which indicate whether a person has had COVID-19 in the past and now may have some protection in the future. Guidance from the Labor Department, Treasury Department, and Centers for Medicare and Medicaid Services said last week that insurers are only required to pay for tests without patient cost sharing if a doctor orders it. I agree with that. But given that the CDC specifically recommends doctors' orders tests in 2 situations, when a person has signs or symptoms of COVID-19 or recently had contact with someone known or suspected to have COVID-19, who pays for the testing at other times? I believe Congress will need to take action to further clarify who pays for the testing at other times. For example, a school may want to do random testing. Perhaps it should make an arrangement with the state to pay for that. Or perhaps Congress needs to provide more money to pay for that. If an automaker wants to test all of its employees at the plant every 2 weeks, perhaps the automaker should pay for that. Or perhaps the state would want to pay for that. That needs to be clarified. Finally, flu shots. CDC has said more people need to get flu shots this fall so healthcare workers can better distinguish between COVID-19 and the flu. CDC says a priority is for all children over the age of 6 months to be vaccinated for the flu so they don't become sick and pass it to more vulnerable populations who could have more severe consequences. On January 24th, Senator Murray and I hosted our first bipartisan briefing on coronavirus at a time when there were only 4 cases in the United States. Since then, this committee has had 4 more briefings. Today is our 8th hearing on coronavirus and U.S. preparedness. Last week's hearing was about steps to take this year while our eye is on the ball to better prepare for the next pandemic. I've issued a white paper outlining 5 recommendations for Congress to prepare Americans for the next pandemic. And that paper has received more than 350 substantive comments that are available to all members of the committee. After all senators have had a chance to ask their questions, I will conclude the hearing by asking our witnesses if they have 2 or 3 suggestions about steps Congress should take this year to deal with the next pandemic, most of which will also help with this one. But this hearing is about what happens now as administrators prepare to reopen schools and colleges. Experts underestimated this dangerous and sneaky virus, and there is still much we don't know about it. But we do know the basic steps to take to reopen schools and colleges in 2020 before there is a vaccine, and those are these: social distance, wear a mask, wash your hands, test, contact trace, and isolate those exposed or sick. And hopefully by the fall, there will be treatments to make the consequences of the disease less severe. I look forward to hearing from our distinguished witnesses how school leaders and college presidents can safely reopen 135,000 schools and 6,000 colleges, and also learning the latest developments on testing and treatments that we can expect during the year 2020 before vaccines arrive.
Our great senators. Hi, Chuck. He used to love me when I was a Democrat, you know.